first became interested in NIPT, obviously I was interested in the literature because of my background in prenatal diagnosis, but I could see that it was going to be a very important emerging area of genetic screening. I think the data that we've generated over the last 12 to 18 months in particular shows that there's enormous potential in terms of improving outcomes. A genome-wide approach allows much greater opportunity to be screening for chromosome conditions that are important during pregnancy for both patients and clinical management of those patients. In our experience, some of the outcomes from expanded screening generally associated with poorer outcomes for the pregnancy than what the CVS data would suggest when we're talking about chromosome problems that are confined to the placenta. We find that in Australia now we're frequently referred patients in with more complicated pregnancies for screening using our techniques. The sorts of additional chromosome conditions that can be detected using a genome-wide approach include placental mosaicism, often referred to as confined placental mosaicism, that may have impacts on fetal growth and development. We see deletions and duplications in a proportion of cases, so these are pregnancies where there's some additional or missing genomic material that causes serious problems in the baby. We see things like unbalanced translocations, which can be inherited from a parent who's a balanced carrier, or they might be de novo, meaning they're new genetic changes. So there's a large number of additional genomic findings that can be of relevance using a genome-wide approach that we can find. I think patients and clinicians can benefit by delving deeper into the genome, using a genome-wide approach, by enabling the detection of serious chromosome problems that won't ordinarily be detected using targeted methods of non-invasive prenatal testing. So a genome-wide approach can detect perhaps an additional 30% of pregnancies that are at risk of serious problems in the fetus from chromosome conditions.